As the nation's hospitals and health systems continue to battle the ongoing public health emergency, now, more than ever, we must harness the collective power of our communities to champion changes that will advance health for every individual. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, Executive Speechwriter for AHA. The Foster McGaw Prize recognizes hospitals and health systems that are leading the way through innovative collaborations that improve the health and well-being of everyone in their communities. While we were not able to present the prize last year due to the pandemic, the AHA is honored to bring you this podcast series to share the stories of our most recent recipients. Our moderator is Janet Porter, a member of the Foster McGaw Prize Committee. Today she'll guide a discussion on how Foster McGaw finalist Texas Health Resources emphasizes top-down investment to improve the physical and emotional health of individuals and communities.
Thank you so much, Tom. My name is Janet Porter, and I'll be moderating today. In addition to being a consultant, I'm a health policy professor, and I've had the joy of serving as a member of the Foster McGaw Committee for almost 20 years. I'm really pleased today to help you get to know David Tesmer, who's the Chief Community and Public Policy Officer of Texas Health Resources, which serves more than 2 million patients in the Dallas-Fort Worth area. Today we're going to be discussing this 2019-2020 Foster McGaw Prize finalist programs that address the needs of the communities it serves. Thank you for joining me, David.
Thank you, Janet. I'm really glad to be with you today.
Well, we want to start, David, by telling you congratulations on being a finalist for the Foster McGaw Prize. As I said, I've been involved for a long time, and it's really an honor to be recognized for the innovative programs that you have to address social determinants of health and improve health in your community. We think all the applicants are terrific, but those who picked our finalists really have a lot that we can learn from, and we hope to do that today. We're going to start by, I'm going to ask you to briefly describe the scope and scale of Texas Health Resources. And I know you're a big place, but if you could talk a little bit about that and then describe a little bit about the demographics of your service area, that'll put your programs in perspective for our audience.
Well, sure. Well, Janet, thank you first and foremost. I think what's always the most important is Texas Health Resources is definitely driven always by our mission of improving the health in the communities that we serve, and we're really honored to be recognized for this award. We really are one of the largest faith-based systems here within North Texas, and if you talk about what's within the North Texas geography, have about 7 million people around a 16-county area, very diverse. We have about 350 points of access within Texas Health to help meet those needs of the community. We're blessed with a wonderful workforce of 24,000 employees, and so they are so critical to how we meet the needs inside and outside of our hospital walls. We provide a lot of great work around charity care and all those things that you would expect from a mission-driven organization. I think what's very unique about North Texas, we are the fastest growing region in the U.S., and we've got a lot of great things going on. However, we also have a number one distinction that is a challenge for us. Well, we have the highest uninsured rate in Texas within the nation. 29% of our adults under the age of 65, or about 4.9 million people, are estimated to be without insurance, and that's up from about 25% in 2018. So that's a challenge for us, as well as something that we strive to meet each and every day.
So, David, before we get to discussing the strategies that you have to address the social determinants of health, I want to talk about something that was really unique in your application. So Texas Health Resources has been named number 9 in the country by Fortune magazine for their best places to work list, and number 19 on Fortune magazine's best workplaces for giving back lists. So can you talk about how being an employer of choice is really synergistic with the work you're doing to promote healthy communities?
Oh, thank you, Jan. Well, first of all, our employees are first and foremost. They help make up Texas Health Resources. And so we are blessed with the culture here. I've been with the system over 25 years, and I can tell you since day one, the culture at Texas Health has been all about taking care of each other, but also taking care of the community that we serve. We have something within Texas Health that I have not found anywhere else in my travels and conversations throughout the nation. We have what's called the promise, individuals caring for individuals together. And that really has set our tone for many years around how we engage with each other, how we engage with the community, the respect that we have for diversity. And I think that the fact that we have always focused on that first and foremost has really taken that culture, as I mentioned, not only inside of the walls, but outside of the walls. So with that driving, everything else, Janet, comes into place. When you start with that focus first, everything else around how people feel, how people are satisfied with their work, how they feel that the organization is not only treating them, but treating the community is something that I think we're so blessed with in Texas Health. And that is our guidepost. And that will be something that I believe that will continue to make us a great place to work, but a great place to be a servant leader, first and foremost, within North Texas.
You know, that reminds me of a noted administrator who was recognized nationally for high patient satisfaction. And she said to me, Janet, I don't really focus on patient satisfaction. I focus on staff satisfaction.
Well said.
So let's talk about some of the initiatives you have facilitated that have addressed the social determinants of health in your service area. For example, Texas Health Resources has worked with Healing Hands Ministries and the Northwest Community Center in Vickery Meadows, which I know is a densely populated immigrant community, and that you've made this commitment really almost 20 years ago. So could you talk about those initiatives?
You bet. And I think you just brought up one that I always have kind of top of mind. So as you mentioned, our flagship hospital, one of our flagships, Texas Health Dallas, is right across the street from an area called Vickery Meadow. And as you said, Janet, this is the most densely populated, ethnically diverse area. You got 26,000 residents living in a 2.68 square mile area. More than 40 languages are spoken there, and 12,000 multifamily apartments and condominium units. So it's very diverse. And as we saw folks coming into our ED, we noticed that there were so many things that we could be doing, working hand in hand with the community. So we partnered with Northwest Bible Church, the Healing Hands Clinic that you just mentioned, and we were able to come up with not only a program, but actually to come up with a community center that really focuses on holistic care. So there's room within that center to serve individuals, families from spiritual, emotional, physical types of issues. And it's through that we're able to really provide that, as I mentioned, that holistic care in a one-stop shop. Just for lack of a better term, it's a way that we can work together with partners. And as Northwest Bible Church told us, they used to do mission work overseas. And when they got involved in this work, they realized that they could do a lot of great ministry and outreach right in their own backyard. So together, once again, collaboration, working with the community, providing a place-based response has been such an opportunity for us to live and learn how to improve the health and well-being of a community such as Vickery Meadow.
Yes, I think a lot of people will be able to relate to similar communities they have in their service areas that could have such an impact on. So your Healthy Education and Lifestyles program, you call it the HELP program, has been spread throughout your system because you piloted it. It's having incredible impact on the lives of your diabetic patients. So I know this program has reduced ED visits by 80% for those who've participated and admissions by a shocking 94%. So talk about your HELP program.
Well, you said it. We always have to have these great acronyms within healthcare, but more importantly, this is a wonderful program, as you mentioned. Yeah, we did pilot it at one of our smaller hospitals, but then we were able to see, as you mentioned, that there was a real opportunity to change the dynamic, to really not only treat, but educate and support individuals who are really suffering with, in this case, chronic disease or diabetes. Really, what's the most important part of this is that we work together from coaching and education to support these patients and how to help them really self-manage their chronic disease. So we've been able to advance this by bringing in more key community partners to really help address the social and environmental issues. So we brought in pharmacies, eye doctors, counseling centers, food banks, and more. And all of them work together, as you mentioned, to make some significant improvements in not only one's health care, from blood pressure, hypertension, but we've even helped people to actually purchase a new car and to help them get a job. But it was not Texas Health doing it. It was Texas Health working with those partners that I just mentioned. So it's a great way to target, do evidence-based intervention, but more importantly, making a real difference in the lives of people that are dealing with chronic illness.
And what a great example this program is, that if you affect social determinants of health, you can really impact health status and unnecessary utilization of healthcare resources. So congratulations. You know, you also in Texas Health Resources have made an incredible commitment going back a couple decades to help people of sexual assault. And I was surprised to hear that in your application, you cared for 665 victims of sexual assault just in 2018. And I know that research has shown that there's a 95% increase in prosecution when the victim is cared for by a sexual assault nurse examiner. Can you tell us how your program works?
You know, first and foremost, unfortunately, it is a problem, and one that we've seen actually grow during the pandemic around just assault, let alone sexual assault. Our program basically takes the opportunity through all of our hospitals to be able to provide a safe environment for the individual. So we provide that care in terms of not only the clinical care, but the holistic care. And then we also have the opportunity to take these programs and train other hospitals and health systems on how to set up the same program. So it's really a great opportunity for us to bring in the prosecution and the police aspect, the social services, but keeping the integrity and the respect of that individual going through that. We've also been able to, and what most people don't understand is we've taken those examples of the challenges that we have faced in prosecution in terms of the police coming us and saying, you know, gee, we wish we could make some changes in the backlog of cases. Through our public policy efforts at Texas Health, we've gone down to the legislature and we've actually advocated and made changes in legislation that reduce the backlog of cases. We've worked with city and counties to look at, you know, prosecution and help those offices. So not only have we helped the issue individually, but we've also been able to help it from a public policy and a public health standpoint as well.
Wow, what a great example of thinking outside the box in terms of not just improving the care to those who come to us seeking care, but how to change policy to actually impact the community at large. Terrific example. So you mentioned at the beginning that you're one of the largest faith-based organizations in North Texas, and you have a faith community nursing program that's been working for almost 20 years with congregations to improve health and has many dimensions. So describe that program for us.
As you mentioned, working with the faith community, you know, faith and spirituality is an important piece of what we do, you know, the natural extension of that inside and outside of our hospital walls. As you mentioned, we've got about 300 volunteers, registered nurses, and health promoters who volunteer their time within certain congregations or places of worship. We have a very small team that goes out and works with those volunteers, and we have developed with those over 100 covenants. We call them covenants because it's an agreement between Texas Health and that faith community, and what can we do to work together to improve that congregation's health and wellness. So we'll work together on blood pressure and screenings, CPR, advanced care planning, really connecting those members of the congregation with their volunteer nurse or health promoter to really connect them to community resources. So it's been a wonderful opportunity for us to learn even more about making those connections with those faith communities and those leaders to say, look, what can we do to help improve the health and well-being of your own congregation? Those trusted relationships are within those congregations, and we found that working through that, it's a wonderful opportunity to make meaningful, trusted improvements to those faith communities.
Terrific. And David, you know, I know most of the people will be familiar with social determinants of health work, but I'm not sure everybody would be familiar with the work done to study blue zones, those zones in the world where people live the longest and are the healthiest, and then to try to bring those concepts into communities across the United States. And I know you're instrumental in leading that effort in the North Texas area. So could you talk about your Blue Zones work?
You bet. And it's something, as you mentioned, that we had the opportunity years ago to read and learn more about the whole Blue Zones concept. So let me just level set. So, Blue Zones is really a well-being improvement initiative that's really designed to make healthy choices that are easier through change, whether it be through physical environment, policy, and or social networks. So we've been able over many years to work together with partners to really help from, as I mentioned, changes within the community, very grassroots driven, that help the community improve its health and well-being. And I think a way to look at the metrics on that is when we looked at the Gallup Well-Being Index back when we first started Blue Zones about 5 to 6 years ago, Fort Worth, Texas, which is where we have this, which is the largest Blue Zone, they were 185th out of 190 metropolitan areas in terms of their health status and well-being. Last year, that number really improved and literally went to 31. So 185 to 31 in the right way, right, in terms of improvement. So now Fort Worth is in the 20% of the healthiest cities within the U.S. But most importantly, it's a sustainable change. We don't own it, the community owns it, and it's going to continue to move forward because of the fact that the community took this on, and all we did was help serve as a catalyst to make those changes. So we're so proud of that. We're even looking at how we might be able to move that into other parts of North Texas, but it has to be owned by the community and supported by community partners and leaders such as Texas Health and other groups that we've worked hand in hand with. So it's been a wonderful opportunity, and we've learned so much through the process.
David, I'm so glad we're not on video right now because my mouth fell open when you said that you made that progress in 5 years. That is an incredible success story.
Thank you.
You've managed in the last year continue to make this commitment to community-based work despite the fact that we've been in a pandemic. Despite COVID-19, I know Texas Health Resources has remained true to their commitment to work on improving health. So can you talk about how you've managed to keep that focus during COVID?
Yes, Janet, thank you. And I think that's something that we also would like to learn more about how other health systems have worked through. Well, we like to use a term around here. It's called pivoting. We've pivoted a lot. We've had to, really look at how we can improve how we are providing that care within the community. So we have done everything from look at how we can do more work online in terms of doing programs and resources that really look at how we can reach the community different ways. Also being very cognizant that a lot of folks don't have internet capabilities and broadband, so it's made it a little bit of a challenge. But we call it Texas Health Community Impact. We brought together partners from different sectors to work, as you mentioned, on the social determinants. More importantly, we've been able to provide grants. Over the last few years, we've awarded $10.2 million in cross-sector grants, which really work with the local community. And we provide those grants to groups who want to collaborate and work together. That's how we've moved forward. We've used a leadership councils, 5 of them, to help us drive those decisions. We have a impact board that also helps make a decision. But I have to give a lot of credit to our CEO, Barclay Burdan, has been at the forefront of these efforts and has guided us into how we can extend out into the community, doing things a little bit differently, as I mentioned. But we have not lost the focus of you've got to work with the local community and find out what their needs are, not only quantitatively, but qualitatively. So we're going to continue down this path and continue to make investments with partners to really serve the vulnerable and the underserved areas within North Texas.
And David, when you talk about reaching out to the community through this podcast, you're reaching out to communities all over the United States, and I know that you're willing to take calls from them about your programs and services so that they might learn and improve their delivery and their overall health status of the citizens they serve. So congratulations again, and thank you very much for joining us today.
Well, thank you so much, and once again, thanks to you and the AHA, and Godspeed, everybody, and thank you once again.